Good morning once again. I'm Dr. Siddharth Sheth, and topic for my free paper presentation is effect of glare on contrast sensitivity in eyes with trifocal IOL with high angle alpha. So this is a subset of the previous study only, so same patient eyes. For trifocal, bifocal and other modern design IOLs with diffractive rings, centration of the optic is more critical. Angle alpha is helpful in predicting the centration and visual outcomes in eyes with multifocal IOLs. Higher angle alpha results in reduced visual quality, glare, and other unwanted symptoms. However, there is limited literature available about the effect of glare on contrast sensitivity in eyes with trifocal IOL with higher angle alpha. Acris of IQ Panoptics is a trifocal lens which provides excellent uncorrected far, intermediate, and near visual acuity. Panoptics is the first US FDA approved trifocal lens. Thus, we studied the effect of glare on contrast sensitivity in eyes with Panoptics trifocal IOL with higher angle alpha. It was a prospective study done on 56 eyes who were implanted with trifocal lens. So the study duration was again same between September 2019 to February 2021, and patient age group was between 40 to 70 years. Post-operative best corrected visual acuity better than 0.2 logMAR units were included in the study. Patient with subjects with IOP more than 22 millimeters of mercury ocular disease, prior refractive surgery, or any intraoperative complications were excluded from the study. So angle alpha is the distance between the center of visual axis and optical axis as seen in this diagram. Eye trace aberrometer was used to measure the angle alpha at 1 month post-operatively. For statistical purpose, we divided the eyes into two groups based on angle alpha magnitude. Group 1 had eyes with angle alpha which was lesser or equal to 0.45 millimeters, and group 2 had angle alpha more than 0.45 millimeters. We chose 0.45 millimeter as cutoff based on previous literature, where the mean angle alpha value of cataract patients was determined to be 0.44 millimeters. So effect of glare on contrast sensitivity was measured at post-operative 1 month using CSV 1000 HGT vector vision chart. Contrast assessment was done at 4 different spatial frequencies, 3, 6, 12 and 18, with and without glare. This instrument has different spatial frequencies where from left to right the contrast sensitivity keeps reducing, and at the same time it has a light source which is automatically calibrated by the machine. So we can use the light source, or without the light source we can calculate the contrast sensitivity. Total 56 eyes implanted with Panoptics IOL who met the inclusion criteria were included. Mean age was 54.45 years. Distance best corrected visual acuity mean was 0.12 logMAR units. Mean angle alpha in group 1 was 0.33 millimeters, whereas in group 2 it was 0.56 millimeters. In both the groups, as we can see in this table, the contrast sensitivity was reduced in the presence of glare. Without the glare it was better, in the presence of glare it was less in both the groups, but this was statistically not significant except at the spatial frequency of 3, where it was statistically significant. Also, the contrast sensitivity was found to be reduced in group 2. If you compare group 1 to group 2, the contrast sensitivity was lesser in patients with higher angle alpha. But again, this difference was not statistically significant. So ideally we want the diffractive rings of trifocal IOL to be concentric with the pupil and the center of the optic lined up with the visual axis. This will give the best visual performance with the IOL and the best satisfaction of the patient. This means smaller angle alpha, that is closely placed optical center and visual center, will give the best possible quality of vision. In our study, even though we did not find any statistically significant effect of angle alpha magnitude on contrast sensitivity with or without glare. This could be again attributed to the inner ring diameter of the Panoptics IOL, which is larger as compared to other trifocal or multifocal IOLs, thus tolerating more magnitude of angle alpha. In the present study, the mean angle alpha value was 0.56 millimeter, which is almost half of the IOL inner ring diameter, which can incorporate even up to 0.6, 0.7 millimeters of angle alpha. Contrast sensitivity is more complete performance related measure of functional quality of vision after cataract surgery. In the present study, we used Vistec contrast sensitivity chart, which is more reliable and repeatable. Vistec measures contrast at different spatial frequencies, unlike other standard contrast sensitivity chart like Paley-Robson or Bailey-Lovie chart. So to conclude, no significant effect of glare on contrast sensitivity was noted in eyes with higher angle alpha in our study of patients implanted with PanOptix trifocal IOL. More studies with larger sample sizes are required for evaluating the effect of magnitude of angle alpha on contrast sensitivity in patients implanted with modern day trifocal or EDOF lenses.
In my opinion, if these two papers could have been combined into one, you just needed to add glare to the subject of the first paper, because the group is the same, the patients are the same, the time is also the same. It is the same group. You
Exactly,
also
the
admit
patient-
that.
Yeah, but only the instrumentation was different.
That could have been included in the first paper. Only thing is, you got the benefit of presenting two papers instead of one, to be honest.
I was not
I'm giving my
expecting
frank
both the
opinion.
papers to get accepted.
But anyway, it's all right. But did you all take subjective opinion of the patient into consideration? Because very often the instrument may not measure glare,
Yeah.
but
Yeah.
subjectively the patients do complain. So
Did
was
they have any problem in
yeah,
their
did you
day-to-day
all
life?
ask, was that part of your study or no?
Yeah. So, ma'am, this is actually a sub-part of a larger study which we are doing where other aspects of the trifocal lenses.
That means another third paper is
No,
coming.
not in the currently in this thing, but that will be coming. So, in total, it will be coming in future. Yeah.
Sorry
So
for
I-
that,
yeah.
but just to keep it a little light-hearted.
I think we'll
I appreciate the feedback. Yeah.
No, fine. No, but I wanted to know that because, subjective complaint of glare is very common in patients, especially those who drive at
that-
night.
Ma'am, just to add this, the paper which we are this ongoing study where we are evaluating it with the other IOLs. So definitely we have found subjective also, but which was again lesser in lenses like PanOptix as compared to other lenses.
There is no financial interest
No,
huh,
ma'am,
in
No,
PanOptix.
you have to mention that first.
You should have mentioned that. In both your papers, I was about to say, since you are mentioning the name of the IOL, you must write that there's no financial
Ma'am,
interest.
I have
Have ma'am?
mentioned.
Have
Very
you?
good,
Yeah,
very
I
nice.
have
Very
mentioned on the second slide.
Okay,
Yeah, very
perfect.
good.
That's the way to do it. Okay, fine.
Thank you.
Any other questions?
There was a mesopic pupil and mattress in such studies.
Yeah, so exactly in such studies, the important part is the pupil size. When you change the pupil size, all the values will change. So we have kept a fixed pupil size of 4 millimeters. That is a option available in iTrace thing where you can select a fixed pupil size and only on that pupil size you will get the values.
So who was the surgeon here?
It was a mixed
Multiple
surgeons
surgeons.
for, yeah.
Multiple
It's
surgeons.
not a single surgeon.
No, not a single.
And was the IOL centered with the Purkinje images of the
Yeah,
microscope?
intraoperatively that was
That-
seen.
I
and
think that is very important.
yeah,
we
that-
should
that
we
was-
should have
yeah.
added into your
Yeah.
this thing presentation that, because that makes a lot of a difference. Otherwise, decentration. Primarily, if the lens is decentered, if it is not at the
Exactly.
Purkinje image, and all were done under topical anesthesia or under the block
So
anesthesia.
out of 56 eyes, 3 were under local anesthesia and remaining 53 were under
Total, how many cases were there?
56 eyes.
No. These are after the exclusion criteria.
Yeah,
After
yeah.
incorporating
so
the
during
exclusion.
that study period, the number of surgeries which were done with the same lens was around 89, but after the excluding all the other
I
criteria.
think that has to be
Yeah.
that total 89 cases were there,
Yeah,
but we have included
So,
56.
yeah,
That
according
is
to
the
our
right way.
criteria, 56.
Yeah. Okay.
Okay, we'll go to the next one.